are live for episode 20, our season finale of season one of Mind Your Body and Soul, the Healthy Podcast, which is the healthiest podcast out here right now. I am Joseph Ward. I'm joined by the incredible Mr. Mathias Sweet.
What's up,
And
y'all?
what's up? So remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related, with to help our listeners learn more about various health topics and information they may or may not have access to. We seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves. And remember, we're usually available on every Wednesday, but we did a little something special this time, and we're gonna let you know what it is. But remember, visit our website at nmcpodcast.com to learn more about our podcast. You can also catch us on Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, and of course, YouTube's or our neighborhood's Medical Center YouTube channel. Make sure you subscribe to the channel and hit that little bell so you get all the notifications when we drop new videos. Also, like, comment, share. So that way, that algorithm can pick us up. We get more of this information out because look, this is a good one today. So yesterday, February 7th, was National Black HIV/AIDS Awareness Day. And we also have Valentine's Day coming up. So we always try to make sure that we can do something for both. But of course, coronavirus made stuff a little spicy this year. So we had to kind of think outside the box. So we got some Valentine's Day things coming up. But this one is focusing more on NBAD. And NBAD is National Black HIV/AIDS Awareness Day and our season finale for season one. So we had to end it right. We had to end our season off right. We can't be half stepping. So we brought in two heavyweights to help us end this season off right. So Matthias and I, so we got to set it up right.
We got to set it up right now.
We was a part of a leadership training this past summer. And the two gentlemen that are with us today were a part of this leadership training. And Matthias and I, we learned a lot from this training. And we learned a lot from these gentlemen as well, because they are our allies in our fight to help to stop the further spread of HIV/AIDS, especially in the Black community, but overall. Yes. And we were inspired by these gentlemen because we would have conversations after the training like, man, they got their stuff together. We got to get our stuff together. They got their stuff together. Started an organization from the ground up in the Houston, Texas area. Put with their passion, their effort, their grit, their education, and just everything that they wanted to do, they created an organization called the Normal Anomaly Initiative. Straight out of Houston, Texas. I want to say thank you, and I want to introduce everybody to Mr. Ian L. Haddock and Titan Capri. Welcome, gentlemen.
Welcome.
Yeah. That was an amazing introduction. Thank you all very much.
Thank you. We had to show you the little Southern hospitality. We
right.
Yeah. Like, I just want to know, can we get it again? That's all. Can we get it?
I travel.
That's good.
I go wherever you need to go.
Because you got me and Ian over here cheesing like some Chester cats. Like, yeah.
Hey, man,
showing these curlies.
But you know, you all, like we say, you all do great work. We, like Matthias and I, we had several conversations about, all right, so what we gonna do to get these gentlemen down with what we got going on? How we gonna collaborate with these gentlemen? Because you can't, when you seeing good things going on, you can't just walk by and be like, oh, okay. Or you can't hate on them. You got to congratulate, and you got to, all right, how can I help? How can I be?
How can we take what you guys do and help put a spin on it down here? Because we reach the same populations, but the dynamics are so different. The whole disparities, everything is different versus, you know, we're a little more south, y'all over here, but we still basically have the same type of demographics and everything. And especially when we deal with the LGBTQ population, it varies from city to city. And knowing that you know what I'm saying, down here in Florida Tallahassee is chill compared to anywhere else. You go down to Orlando, Miami, it's done ramped up 10 times fold. But you know, we travel over there to Houston Splash and we go do different things in Atlanta. So the population, we don't have that. It's big, but it's not as big as y'all's. And the work you guys do with the LGBTQ population and the transgender, it just inspires us because we're one of the only two people here in the city who really go out hard for transgender. And we have a few others who work with us that go hard. We have like maybe one or two support groups and things like that, but we're trying to get more and do things. But we just see like on Facebook and on your Instagrams and things on how y'all go out in the community. And that's something me and Joe do. We hit the pavement and we don't find too many people who are young African Americans who hit the pavement anymore to go help the community. So that's one reason why we really wanted you guys on here. And so, you know, to give y'all stories and tell, so hopefully we can inspire other young men as well as other LGBTQ to come out and to join this fight with us.
Yeah, I think it's an important part, an important point to start with, that we are who we've always been waiting for, right? And when we think about the work that needs to be done, the reality is, you know, we can sit around and we can talk about what needs to be done, or we can talk about the actions that it's going to take to move the needle forward. And I think that, you know, I think that a lot of what we've been doing, you know, advocacy is great, but we got to be activists, right? We got to be active in the movements, in which intersect all of the multiplicities of disparities in which the intersections in which we identify and the intersections in which the people that we work with identify look like. And so I'm just grateful to be around some people that are active, right? And advocating, active in movement, active in changing the very narrative of, you know, what it looks like to sit within these intersections. So thank you all for all you do. And I'm grateful for the support that you all give us.
Yes, indeed. So, I want to just piggyback off of that really quick. Thank you all for what you all do and what you continue to do. And thank you for wanting to have us, you know what I'm saying, on. One thing that I do want to just chime in on, and what Ian stated, is that we basically do the work in, out, and around the community, but it's from people like us, right? And I think that's what I love about it so much, what the Normal Anomaly does. We hit the ground running, like we want to make sure that we are visible. I'm trying to get the words out, like visible. So we want to make sure that we're on the ground being visible. We're in the middle of our community, we're with our community, and we support them like that. So yeah, thank you all so much.
Joe, you want me to start or you want to start?
No, you got the first question. But hold on, I do want to say we're looking forward to this being the first of many collaborations with you.
Yes.
Because we think the world of you. So.
Right. Yeah. Because we really do think, like, when we saw you guys on there and we started hearing what y'all do, and then we started following you on Facebook, I was like, it's other people like me that really want to do something for like the LGBTQ. They really want to do something for trans, because we normally, for September, we normally go out a whole weekend for National Gay Black HIV/AIDS Awareness Day. We do a full weekend where we sponsor 3-course meals, where we have drag shows and pageant. Like, we go all the way out. But we couldn't do it because of COVID. So hopefully this year in September, y'all can come down if everything's clear to fly and everything, and we can have it. We'll come down and we'll show you a good Southern hospitality on how we educate the community down here.
Matthias, you had me at 3-course meals.
Yes. And it'd be like shrimp and steak. It'd be
good. He said steak.
Yeah. So can you gentlemen tell us a little about your background, about yourselves, and how you became to take part in this fight against HIV?
Now we'll take it first.
Right.
Okay. So so we just had a little conversation off the air about my name. My name is Titan Capri, and I've been in the community since 96, 97, around that time. And so I'm a Black gay male living with HIV, thriving with HIV. And so just recently, about maybe a couple of years ago, maybe 2 years ago, I basically stood up and spoke my truth. And so with that being said, I had went to Ian and told Ian that I could no longer be quiet. I could no longer sit in the background. I had been dealing or not dealing with my HIV status for some time, and I thought it was time for me to do that. And Ian had an idea and thought it would be good for me to be a part of that idea. And so it was called the Outcry documentary. And basically, it talked about HIV and AIDS, or us in the Black community, and faith, right? Because the church is a cornerstone of the community. So I was able to go on and speak my truth and be visible, um, be honest about where I was and where I stood in the community. And at that point, I wasn't standing anywhere near where I'm standing now. But I was able through the documentary to stand up and speak my truth. And that's what kind of got me started. Then to know that Ian had already produced the Normal Anomaly, doing good things in the community. And then he brought me on and we kind of expanded what that was. And the reason that I think that it spoke to me and allowed me to be where I'm at today, because it allowed me to be authentically me, just directly me. Like you said earlier on the ground running, right? Representation, things like that. And I didn't see a lot of that. And so with that, the Normal Anomaly allowed me to get in the fight, stay in the fight, and still be in the fight today. So yeah.
Okay.
That was a pageant answer. I felt like that was a pageant answer.
There was a pageant answer, and I'm gonna have to go look you up and find out. I have to watch, because I watch pageants all the time, so gotta go back and watch it out on YouTube.
Okay, check me out.
I've been in the public health world since about 2009. So I came in the public health world. I had a really interesting, I guess, entry into the public health world. I was the one that they was trying to save. I started this work from being a sex worker. I was a prostitute, and I was going to get tested pretty regularly. And I think both my counselors and myself were surprised that though I was getting other STIs, I was tested negative for HIV. And they were like, "What are you doing?" And I don't know. I'm just coming to get tested quite often to make sure I'm okay. And they offered me a part-time outreach position off the street to meet the needs of people that looked, loved, and did some of the things that I was doing. And I got really, really intrigued by the idea of being a part of this work. I was pretty much adopted around 16 by a person who was openly living with HIV. And so this was something that I had been hearing a lot about from that person. But this was my first entryway into that type of position. And I worked through the system, because whether I was doing sex work, because sex work is work, or if I was doing outreach work, the reality is I was just, very tied to it, and I was very passionate about it. And so I worked through the system for about 5 or 6 years until I got to the county. And I worked with I managed some programs with the county for about 9 months. And I was sitting at the county 2 days before my 30th birthday, which was, a little over 3 years ago. And I was sitting there, it was like the 27th of October. And I remember sitting there thinking, like, all my job at this point is to find people living with HIV. Is to test as many people as I possibly can until I find people living with HIV. The more I find people that look like me that have HIV, the longer I can be here at the county and the longer I can keep this retirement plan. Mm-hmm. And at some point I said, is my community worth just a $50,000 salary and a cubicle? And on October 30th, I put in my resignation, and they let me go on my birthday, which is November 1st. So since November 1st, around 2016, I have been doing this work with the Normal Anomaly. And it came just from an idea of there is more to us, and we need more The reality is we can talk about ending the epidemic by finding new positives. That's important. We can talk about ending the epidemic by getting people on PrEP. I've been on PrEP since 2015. That's important. We can talk about stigma in a theoretical framework. That's important. We can talk about theories, sociological theories, such as diffusions of innovations, and so on and so forth. That's important. We can have patient navigators and peer navigators and social workers. All of that's important. But until people see that we value their lives, until we teach people how to value their existence, until we actively fight stigma by people like me who are not living with HIV, but will step up and step out without somebody being present, because you never know what it looks like, until we normalize whether public health accepts it or not, until we normalize condomless sex and talk from a framework that understands that people are doing it, and that we cannot monitor adults' bodies, but we need to work from there. Until we really get honest, we will not end the epidemic. And so I realized I could work for a lot of organizations, and we do work with a lot of organizations and consulting in different ways. But the reality is going to take a radical look at white supremacy, a radical look at the public health framework, a radical look at social justice to end the HIV epidemic, because this is not just a public health issue. This is affecting Black and or queer people. This is affecting Latin and or women, right? So this is a racial and social justice issue, not anything different than when we talk about wages, when we talk about other health disparities, when we talk about police brutality. This fits into that same framework. And until we really look at that, we're going to have a hard time ending the epidemic. And so the Normal Anomaly was created to be that agent, that change agent, that agent to push. And we're not done yet. We're just beginning. I'm grateful for the journey.
You sound like a conversation me and Joe have every day. And that's the sad part. It's like we out here doing the work, but it's like you see people who come into the community and like, oh, I want to be here, I want to help. But then you come in here, get your numbers, and you go. And then the people be like, they don't know you. Me and Joe motto is, if you ain't got a street nickname or a hood nickname, you ain't out there doing the work. So that's what we really look at, and that's what we admire about you guys, because y'all are actually hitting the pavement like we do. Right. So it's like it's a great comfort that we can find somebody else that hits the pavement, because now we can call and be like, hey, I'm struggling with this. How can I get this through to this person? Yeah. Especially that you showed your story, and I commend you for sharing your story, because both of you guys have a tremendous story that I couldn't imagine even sharing, because we all come from different walks of life, and that's the best part about it. And we can relate to everybody from each thing, but you can relate a little bit more than I can for certain aspects. And so now I'm definitely going to reach upon you guys for more, because we deal with a lot of commercial sex workers, and we deal with a lot of people who are HIV positive, but it's hard for a straight man as Joe and a homosexual man like myself, who really hasn't been in those disparities at all, or haven't had to go through them things. I know people who've been through there, but I can't really relate, but I can empathize. And so I know people and hear stories and things like that, but it's just great to have somebody I can say, hey, let me call somebody and I can figure out who's been in your same shoes in your situation. And so that's what I like about the peers and the things that you guys do. So it kind of goes into our next question. So because you almost answered it, is there anything else you want to tell us about the Normal Anomaly initiatives in your organization?
Yeah, it's centered around, HIV advocacy, but it is not an organization that focuses on HIV. We focus on racial and social injustices. And we want to just always make it clear that focusing on HIV is focusing on racial and social injustice. It is focusing on white supremacy. It is focusing on how Black trans lives can't matter just for a hashtag, and how we can't wait on a hashtag. It is focusing on how sex work is work, especially I was talking to somebody just real quick, and I'll let Titan take this over, but this brings up something. I was talking to advisory board for an organization, and the organization is looking for someone that has some expertise around substance use and substance abuse. And I found it so interesting that the first thing on the employment application was a master's degree. And I said, okay, cool. The second thing on the application was no felony background. I said, oh, so you want somebody that knows substance abuse from theory, not someone you want from personal experience. Because likely if you've had real substance abuse or substance issues, you likely don't have a master's,
Right.
and or you have a right?
Right.
So it's really important for us to, keep these things in context. And so that's why I'm always pushing the envelope. Will not end any epidemics between Black and brown bodies against queer and non-straight. Let me know, queer and non-heterosexual males, even though heterosexual males, that's the whole thing, Joe, which I can talk about in the common questions, because I think that we miss out on straight males and their allyship and the things that they need also. But we won't be able to end any disparities on Black bodies until we really expand this and call it what it is. It's white supremacy.
Yeah. I think that Ian hit it right on the nail, on the head of the nail. I think that Ian and I have had, probably like you and Joe have had conversations. We have conversations all the time about certain things, and we would see in the community, and we would say to ourselves, okay, wait. So what happened was, one time I went to, just to be real quick, I went to I call them gatherings. Ian liked to laugh when I say gatherings because I am Southern, even though I'm Southwestern. But I went to a gathering that was supposed to be a safe space. And I walked into that space or that place, and it wasn't safe at all. And I told Ian, as I stood there and I looked around, I saw our community, and I thought to myself that I'm a part of this. Like, I am truly a part of this because I'm being quiet. I believe silence is violence. And so I was just being quiet because I didn't know where I fit in. But as Ian stated, the Normal Anomaly became that radical organization to stand up and say, okay, this is not what we're going to do. We're going to go out and talk to our trans sisters and brothers. We're going to go out and talk about sex work. We're going to go out and make sure you know, because just like he said on the application, how you going to have somebody with a degree or with a master's that you want expertise in drug use? Like, how does that even work? Like, how does that work? Now, through theory, it works, right? But we already know that if you have anything, you have experience. And on those applications, they always say, oh, well, if you have 5 years experience, well, yes, I have experience on the ground running. So I think that the Normal Anomaly being a small entity in the beginning was our way of getting that skeleton key to get into where we're at now. So we had to kind of like bust through under the door. Now we just go to the door, stick in the key, turn it, and open it up. And that's how I think that a lot of people didn't see us coming because we were so radical in a sense. I think that's the only way that we could be, because we need to put it in your face, if I can say that.
But that's real, because like that's how I think. And so I tone it down a lot because I don't want to get Mathias in trouble or anybody else in trouble. But like, we'll be at certain places and somebody will say something and he'll look at me and you can see it all on my face, because I'm not real good at hiding expressions. But my thing is, if we're really out here to help people, then that's what we're supposed to be.
Right.
We're not supposed to be playing around. People don't theoretically go through health disparities. People don't theoretically go through any kind of racial disparities, anything like it's real life is happening out here, not theoretical things. So we can't keep that mindset. Well, if we do it this way, then things will be okay. That the politically correct thing, it has its time in this place.
Yeah.
But for the most part, we out here really saving lives, like for real. So we have to make sure that we bring a realistic approach to what we do.
Joe, we have this thing. Me and Ian always joke about this all the time. I was like, I used to always say this on a podcast. We got to meet them in the streets.
Yes.
I can tell you how the streets are if I'm standing behind a screen door, behind a burglar bar, behind the shades. I don't know. I don't know. So when Ian first went out, we first went out. He was like, blah 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 blah, and people were like, what? And then I was like, oh, okay, so that's how we get down. Okay,
Yes.
well, let's go down and say it. That. So no, I get it. I get it because Ian does this thing. I always joke with him about this. He does this thing where he rolls his eyes, like when something is just not right at all. He'll do that old rolling eye thing, and then I'll say, "Brother, you wasn't feeling that, were you?" He was like, "How could you tell? You rolled your eyes."
Yeah. Yeah. Now, but it's like for me, I think about for myself, I claim to be pro-black for me. So that means I'm down for all black people, and I'm down to make sure all black people can be lifted and empowered and thrive.
That part.
Now we understand everybody don't want that for themselves, but that doesn't mean that we can't strive for the greater part of us or all of us, as many that want to come to make our situation better. For me, that's just my approach. If we're going to do that, we're going to do that. And also, not outside of or in addition to being pro-black, we're here in public health. The health of other groups of people affect the health of my people.
Hello.
So we need to be, we are down here to help any and everybody who we can reach. That's
what we do. And like how y'all say you can tell when his eyes rolls. I can tell when Joe and I be like, Joe, that's not your fight. Let me fight that battle. And then it'd be like, I need you to step over here and I'll take it from here. Because you gotta when you work for a big organization, you gotta understand you got to save face sometimes. It's the time and place for everything. Y'all a smaller organization, so y'all get away with a little bit more than what we can. And so it's like you be looking at things and you be like, I know this not right, but I need to figure out how I can fix it on the back end and figure out what we can do and go about doing it the correct way. Because if you know what I'm saying, you got things and it's politics behind everything, especially in public health. No matter what people say, it's a politics behind it. And if certain people don't like what you're doing and things like that, things could happen. So you just got to really look at it and see. But it's like, there's days you be like, we talk and we be off candy. And I'm like, Joe, I really want to just, but we got to make it work and figure out how we can do it. Because at the end of the day, our goal is to reach everybody. And like me and Joe say, we don't care what color you are. We don't care what you are. People walk in the street and say, hey, you got condoms, because they know we got condoms in our car or we got them on us. Or they call me and say, hey, can you tell my girlfriend I'm negative? I don't know if you is or not. I can't tell you that. You come and get tested together and then y'all give each other y'all paperwork. So it just depends on what, is out there. And it's just, it's a good feeling when you know you're out there doing the right thing. It might not seem like it all the time, but it's a good feeling when you know you're doing the right thing and people can't come back and say, they did this wrong or they did this, but they can't do nothing but speak good things about you.
Right.
And so that's the pleasure Joe and I get out of it. And it's like kind of like the same thing. It's just, but it's hard out there. We know, trust me. We know.
So
go ahead.
No, go ahead.
No, I was going to say in the beginning, they tried to put up some roadblocks. And because we were going left and they wanted us to go right. And Ian was already like in the mode of F it. You know what I'm saying? Like, forget y'all. Like, this is mine. Like, you can't tell me what to do. However, the same thing that you just mentioned, they were talking about us doing it the wrong way, quote unquote, but they were speaking highly of us because we were reaching people. People were starting to use our name and talk about it. And hey, y'all over here. Oh, okay, Titan. So what are you doing? Oh, the Normal Anomaly is doing this. So Ian, what are you doing? Normal Anomaly. And then it became one of those things to where, like I said, we came out of nowhere and just was like, boom. You know what I mean? But we had to do the work on the back end first, like you said, and get in that door, right?
Right.
So once you in there, you in there.
Yeah. Right. So let me ask this, because I like the direction of the conversation, and this next question really just fits right in. So from you guys' experience, understanding, research, and just everything that you know about HIV/AIDS and Black America, from you all's perspective, what type of impact has HIV/AIDS had on Black America, whether it's positive or negative? So I start with you, Ian. What type of impact has it had from your perspective?
Yeah. So when you think about us being, roughly 12 or 13% of the population, but 42% of new HIV infections, you can't help but to think of how powerful this disease has ravaged our communities. And a lot of research has been done around, women. A lot of research has been done around gay men, but we always leave out straight men because straight men don't really get tested. So I don't even think we really understand the impact in totality of what HIV means for, Black America. But I think that it is indicative of the multiple pieces of oppression in which we sit in as it relates to the United States of America. Now, I do not deny the United States of America is the greatest country on earth. That does not mean it can't be better, and that does not mean it's not great for a particular piece of marginalized people. And so I think that it's just another one of those indicators. I think that because when you work in public health, especially in any type of STIs or things like that, like HIV, around HIV or hepatitis, even if you work in tuberculosis, you begin to look at the disease as kind of like the input or even the output, right? But I wrote this in an article this week, and I said, no matter the input or the output, the outcome is always that it disproportionately negatively affects Black people. COVID in as an input or output. If you put HIV, if you put jobs or unemployment, if you put anything that you put in there, it almost always is disproportionately negatively affecting Black people. And I think this is just another indicator. It's just another indicator on the work that we must do. I will say this, and just offer this. I think we unrealistically put the weight of dealing with the effects of disparities on Black and brown people, specifically Black people. We can do a lot of this work, and I alluded to this before, but I just want to make a clarifying statement to what I've alluded to before. We can do all the work we want. We can try all of the modalities that were created. We can look at all of the theories, but the structure has to change.
Yes.
Because if the structure does not change, then it does not make a way for us to develop a new narrative, to change what we want to. I kept on alluding. Well, I said that HIV is a racial justice issue, but even more clearly, HIV is racist, and it's racist in a way that we don't always get. It's not like a microaggression from a person. It's not a you can't get this job because of your name. It's not I'm going to shoot you in the street. It is I think that I'm going to create a culture to make you feel nasty for doing things that you're actually less risky than the other person, right? Because many times when people think about HIV, especially with black people, sorry, they're cutting my grass. But when people think about HIV, they think about it from this context of, oh, they must be nasty. They doing something that everybody's not doing. But science says different. Science says black people, black gay men, black women are actually not as quote unquote risky or riskier than other populations. It's about community power level, right? It's about community power level. Black people have sex with black people. Black people live in neighborhoods with black people. If more black people have HIV and more Black people don't have access to care to go get their HIV treated, and then they have sex like everyone else does with Black people, they have a higher possibility, a higher probability of getting HIV. That is not because they're nasty. That is not because they're risky. It's because the structure doesn't have jobs in the area. It's because the structure doesn't, which that means they can afford transportation. That means the structure doesn't have access to care for people to get into different places. And that means the structure is really the problem. So we can talk about putting on condoms and getting on PrEP and all this kind of stuff, all this stuff that is really, really important. But if we aren't putting medical centers in the middle of our hoods, if we aren't giving people jobs that give them an appropriate wage, if we don't give people the opportunity to feel comfortable in spaces where they're not Black-centered spaces, then what we do is we create a community of people that all they have to do is have sex, and they're having sex just like everybody else with a higher probability of contracting HIV.
That's real. That's real.
That's real.
I have a saying that I start saying is, you can't clean dishes in a dirty sink.
Yeah.
And I want to get people mindset. Think about one of the nastiest sinks you can find. And all we gonna do is just throw some little dishwashing liquid in the sink. We're not gonna clean the sink. We're just gonna stop it up, put some dishwashing liquid in, and then we're gonna take these dishes and we're gonna wash these dishes in this sink that hasn't been cleaned. You really think those dishes gonna get the cleaning that they need?
Mm-hmm.
So until you either throw the sink out or clean the sink, the dishes will never get cleaned. So that's just the analogy that I've been using for people to get them to realize is structural things were put in place in America for a certain group of people to thrive.
Yeah.
All right. So throw HIV in it and throw the disparities that Black people have. So how do we find ourselves? Well, how do we get ourselves out of the position where we're always victimized within the system to where we can actually thrive within the system? Because like you said, I remember having a conversation with a young girl, not even just sex with Black people, but she was like, unprotected sex is wrong. I was like, well, if it's wrong, you're wrong, because you got here because of unprotected sex. Right. And so it's like, but being realistic about it, being honest about it, but also if we're going to deal with disparities, we got to deal with it.
Right. And Joe, I think it's more like, the generational curses, because when we were younger, most of our parents didn't talk to us. They just said, don't bring no baby home. My mom and dad didn't even know how I got down, so I ain't got to worry about a baby. But you didn't tell me how to protect myself from getting STDs or what an STD was. And that's one thing, like Joe and I do, we keep it real raw in the community with the people. And when we talk to people, and they be like, sometimes we a little blunt, but sometimes you got to be that blunt to some people because they don't know the severity of what it's going to be. Like they try to show them cartoon images. A cartoon image is nothing like a real life image, because you really need to see what's going to happen to your penis or your vagina if something does come in contact with it. And it's something that we need to have people, and that's what I like about the organization we work for, is because we're in those disparity areas. We're in those hoods. We're in those different limelights. Joe and I walk down the streets with the commercial sex workers. We go into the HBCUs. We go into the PWIs. I mean, we're everywhere. We don't discriminate. And that's one thing I like about it, is because we have Black people, white people, Latin people, trans people, and we make events for them and do everything separately to keep up. But it's like, we got to give them the education. And I think that's where the breakdown is. For our structure to change, we have to have the people to get the education. And the education isn't there. Like, you have us four giving the education, but if it's just us four, we still have 48 more states to go.
Yeah.
So that's what I think we need, is the people out there. If we talk about changing the structure, we need more conversations like this with other people to actually sit there and say, hey, what can we teach people? Because like Ian said earlier, how can you talk about different things, and how can you can't do something till you normalize raw sex.
Yeah.
But you got to tell people what's the difference is. If you're going out there and you're in a committed relationship, a monogamous relationship, and y'all are working towards something and you're both getting tested together, things like that. But people don't get that because most of the men out here that me and Joe see, I don't know how it is in Houston, but we get them that come in that backslide. And next thing you know, they with this male, and then they with this female, and then they got a girlfriend and a boyfriend and another person on the side. And so those, when you get into those different dynamics, is what really brings us back to it, because it's not about you getting HIV all the time. It's about sometimes the people who have the HIV, you got another STD, but did you tell that person that you got HIV? So you're getting the education. You're like, oh, I need to make myself safe, but you're not caring about the other people that you're with.
Yeah, and I want to offer this. I know, Titan, you have something to say, but I just wanted to make sure I responded really quickly to that. When I say normalize condomless sex, I am really speaking to the thought of we got to take personal autonomy over our bodies. When we talk about Black bodies being perfect, and not like anybody else's body ain't perfect, but I'm just saying Black bodies at the very moment, because many times those are the people who have the most problems with having a personal autonomy over their body. The reality is we have to create a culture of being responsible over our decisions, right? So it would be nice, right? It would be nice as a person that's not living with HIV, for a person that's living with HIV, for them to tell me, right? But have I created a culture that makes that okay? Have I created an environment that makes it safe for that person to do that? Have we as a people created a situation in which they don't walk away feeling even more broken before something that's supposed to be so liberating happens that they did before? The answer is no, right? So I am saying that is appropriate. And people always want to say, well, it's legal, it's legal. Okay, but police ain't never, legal ain't never worked for us, okay? But that's a conversation. But aside from that, what happens when I am responsible over my body? When I'm responsible over my body, I no longer have condomless sex with the idea that if they had something, they would tell me. I have condomless sex saying that I've done everything I could to protect myself, since I'm probably going to do it anyway. And I am going to be able to deal with whatever happens, because I have personal responsibility over my body. And so I do all of those things. And it actually is a better way to reduce condomless sex than to say, make sure they ain't got nothing. Well, hell, that just means that the person that you're sleeping with don't go get tested. It just means something burned. They drink water.
Okay.
Right. You right though. You right, and that's what Joe and I preach a lot, is making sure you ask. Because one of our questions we ask the people is, have you asked your sex partner when's the last time they were tested? Have you asked them, have they ever had an STD? Have you had those conversations? And as y'all know, you meet on Jet, Grindr, BGC, Scruff, AFA, all them other ones, and you be like 10 minutes and I got my date. What's up? I don't even know his name, but you coming in here talking about he texts me that he's positive and he blocked me. Oh, but did you bother to get to know? You got to take ownership in having sex as being an adult. That's why it's an adult act. And people need to be more ownership. And like you say, take ownership in it. Because if I go out there and get in an accident, I'm drinking and driving, I got to take on the responsibility that I took on to say, I went out there, got drunk, got in the car and drove, got an accident. I could have killed somebody. I maybe killed somebody. But you have to take ownership in that. And that's what the same thing we need to get back to, teaching people that sex is an ownership. You got to take it and own your body and say, this is my body and I need to take ownership and this is what I'm doing. It's not nobody else's fault. We got to take ownership sometime and asking questions and doing what we need to do for ourselves, because we can only look out for ourselves. And that's the only person we can look out for really sometime, because we don't know. The other person might be lying just so they can get what they need to get. But you still got to take responsibility for yourself. I do like that. And I do like that.
Yeah, indeed. And I don't really have too much, because Ian pretty much answered the question. I'm just over here just kicking on the inside about ooh, my brother always got to tell it to you like it is. But no,
that's the best way to do though.
Exactly. And that's why I love him the way I do, because We don't need to sugarcoat it. I think that what he said was true, that we here, for some reason, even though, like he said, America is the greatest country on earth, that doesn't mean that we don't have issues or problems. But here in America, for some reason, sex is vilified as something bad that you shouldn't do, that you shouldn't have. And if I'm a consenting adult and I want to be raw, I want to be sloppy, nasty, whatever it may be, that's my right. But as you stated, and as Ian stated, and as Joe, I'm saying, is stated as well, we got to take responsibility. We cannot put it on the other person. That's just like me seeing my lover cheat and I go fight the person that he cheating with. Like, what am I doing? I should be fighting myself first because I allowed this to go on. I allowed this to go on. 9 times out of 10, you already know. 9 times out of 10, you already know. You already know what
got that
happened. Okay, what's going on? The red flags then popped up. I say this all the time, and I'm gonna say this and I'm done. I say this all the time to my younger individuals: keep the lights on. You cannot see what's going on in your life, in your world, in your sex encounters, if that's what you want to call them, your hookups or whatever, if the lights are off. Because if you're in the dark, you don't know nothing.
Right.
Be in light. You got to know your body. You got to know what's going on, what the possibility is for them, but you got to know yourself. What you're gonna put up, what you're gonna do. Check yourself. I told someone, like you said, Mathias, they catch me at the store and they'll ask me a question. And he said, well, yeah, this happened. I said, well, did you check first? Was there an odor? Was something going on? So sometimes, like you said, you got to be a little radical, but these are the things I think America has put it to where it's separate, right? You do the act, but you don't have responsibility. And so the responsibility is you, not the other person. It's you, period, point blank. And that's what I believe let's start.
It's America is so ironic. Sex is everywhere. It's everywhere. You can't turn on anything without seeing sex. Sex. Oh,
you sell fruit with sex.
but let's not talk about it. Do it, but let's not talk about it.
That is.
So, all right. So, one of the Normal Anomalies initiatives is cultural humility. It's making sure that it's increased. So, kind of explain to us and our audience exactly what cultural humility is and how you go about making sure it is increased within the communities that you work in.
Yeah, I love that question. I mean, I love all the questions. Right? This cultural humility, I don't think it's that new, but it's a pretty new concept. Most people have heard of like cultural competence, right? But the reason why cultural humility, we didn't obviously coin that term, but the reason why we use cultural humility, the reality is people only become competent in things that they're experts in, and things that they have experience in. So many times when we meet different communities and we're trying to get them to understand us, what we do is we go in and we throw out all this information at them and say, now you got to treat us better.
Yeah.
That's not how this really works. Let's be realistic in our activism, right? Cultural humility comes from a place in saying that you're probably not going to ever figure it out. It's probably not going to make sense. If you're a straight man that thinks vaginas are beautiful, I'm not a straight man. I'm not a straight man, and I don't think they're beautiful. But I love women, right? We're not going to understand each other sexually. We're just not going to understand each other. And so, but what we can do is show some humility towards each other, right? We can come from a place of understanding that just because I don't understand it does not mean I don't accept your humanity. Doesn't mean I don't grasp with your humanity. So if I can learn a little bit about your experience, a couple things that comes out of it. The Normal Anomaly, our first tagline was, we're a lot more alike than different. And that's one of the foundational principles of our cultural humility trainings. But the second thing is, it really is about us being together. None of us can be free until we're all free. I say this, when we're talking to white spaces or white centric spaces, that, you know, many times I don't think that everybody realizes that nobody's free until we're all free. The reason why, you know, I think about the insurrection just really quickly. I'm gonna shut up, but I think about the insurrection, and I was telling Titan is, the insurrection wasn't against Black people.
Right.
The insurrection was out of fear of white people losing power.
Right.
And so when we think about that, that is the best analogy to the fact that until everybody is free, no one can be free. Everybody's at risk of losing their freedom until we're all free. And so cultural humility does come from that place of saying, you don't got to get it. It ain't your life. Just be my humanness.
That's it.
Yes, yes. I just really short. When you posed the question, I thought about an answer, and I had to be on this part when I joined the Normal Anomaly. And what I thought about was that we must look at in the mirror and be aware of what's staring back at us, because sometimes that cultural humility we don't have, we don't understand, we don't know. And I mean, as a people, and especially since it's Black History Month, as Black people, we don't get it most of the time. We think that somebody is HIV individuals, HIV positive individuals, or lepers, like they should be put away in cages, they should be done this way or done that way. And sometimes we don't see that we're the actual problem, right? And so I think what happens is we want to acknowledge what the problem is, and also we want to identify the part that we've played in that problem, and we need to adjust and change that. So I think that's what the cultural humility is. Ian and I had this great idea in the beginning, right? And we always tell this story that we were going to do this whole PSAs and all of this stuff for our trans sisters. And we were out there like, yeah, look at us, you know, we're doing this for our trans sisters and blah, 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 blah. But we had not now, and I say now, trans person at the helm, you know what I'm saying? And so we had to go back to the drawing board. We had to be, have a little bit of cultural humility, because we were like, wait, okay. And it took somebody telling us, tapping us on the shoulder and saying, you know, y'all wrong, right? Y'all have a trans person, you know, at the helm. Did y'all talk to a trans person? And right. So it was one of those things, and that's the greatest example that I can think of, because we had all these great ideas, but culturally, or were we really showing cultural humility because we had left them out totally, right? And so with that being said, we went back to the drawing board, brought them in, and it was a better product because of the fact that we looked in the mirror and said, hey, wait a minute. We're doing exactly what they have been doing to us. You know what I mean? Making programs, doing things that do not include us. So therefore, we had to go back to the drawing board. So I think that's what the Normal Anomaly has been doing from the beginning, is making sure that we're all included. Like he said, being inclusive and making sure that we all have a place at the table. No matter what you're doing at the table, you got a place at the table. Yeah.
I do agree with that, because like when we was on a conference, on one of the Ryan White conferences, I met some transgender women and we had a good conversation. Mm-hmm. And it was more like a cultural competency class on one of the things. And the lady was like, how can I go somewhere and I don't see myself represented?
Right.
And I was like, you know, that's right. But she was like, I get it. A lot of people aren't educated. They're not there. They don't have the education. But she's like, that doesn't mean you can't train somebody or teach somebody. And so that's what it is about, is like, I feel like people like me and Joe and you guys, we're willing to take that chance on somebody to say, you know, let me teach you, because I can teach you a lot more than what the book can teach you, because street smarts is different. You can go to school to be a nurse and have book smart, but you don't have that common sense smart. Okay. And so, and we see it all the time with nurses and things like that. And some people, you got the book smart, but you're missing the realistic part, right, or the part that's the humane part, or the part that you have empathy for people. You just say, nope, this is it, this. every time I tell somebody they HIV positive, I feel their emotion, their hurt. It could be the same thing over and over. I could tell 3, 4 people, don't have no connection to them, but I still feel their pain because it's different. Your life is changing at that moment. And people don't have that empathy and that respect. Or if you go somewhere, and I've been there and I've done let plenty of doctors go, because once you figure out my sexual orientation, now you try to treat me differently or try to do things. Everybody should be treated the same. Exactly. And like even in our clinics, you even see like we got little rainbow flags at the window, you know what I'm saying, letting people know that they're, you know what I'm saying, you got to let people know that they're wanted. They want to be there. And when you see people who look like you feel a little bit better. And sometimes it doesn't have to matter, because I'm half black and half white, so I get it. So people think I'm Hispanic and they be like, hey, I'll be like, hola. And that's it. That's as far as we going is hola. I can try to let me get somebody to help me. So, I mean, I get
I'm not gonna lie. I'm not gonna lie. I thought that.
I sympathize with the Caucasian because my mother is white and then my father is black. So I get from all aspects. And, you know what I'm saying, with the racism things, I've seen both sides of it because I got to pick, and I shouldn't have to pick. To me, when I was raised, my parents taught me that there's no color. It's just people. And that's the way things need to get back to. And it's like, until people understand that Black people, white people, brown people, Hispanic people, we all go through the same thing. We just, other people have that picket fence and that facade that covers everything that's not aired. And certain people's stuff is just more aired than others. And so I think once we get past that and we can look into and people feel more comfortable doing things, because Joe will tell you, I will go out there in the middle of the night at the club and be like, hey, I need to see you. Let me talk to you for a second. You're going to have respect for me because I don't have respect for you, because I took my time to find you. I took my time to educate you and talk to you. Trust me, they blow our phones up. My phone rings all day, all night from patients and things, but you got to let them know you care, because once you show somebody they care, you got them forever. Whatever you need them to do, they're going to do for you. And a lot of people just look at people as a number or as a statistic or as I got a 15-minute appointment slot. How many times you've been to your doctor and he been like, okay, well, you know, it's about time, we got to hurry up and go. We take time with you and we sit there and talk, and you know, so you don't feel rushed. And I think that's what a lot of times when people, especially when you become HIV positive, or if you're out there and you got an STD, it's that time to take that time to educate people. Because if you don't educate them, they're going to keep coming back with the same thing. Because nobody's teaching them. And we're not able to break down those generational curses, because you see, most people, they look at, and I don't know how it is in Texas, but here in Florida, you can sit there and have your mom, your grandma, and your grandma right there in the same thing, and y'all just about a 20-year gap, and everybody got kids. So it's like, and they all on the system. It's like, well, let's try to get something better. Let's see how we can help you break out of that and get out of that fact that everybody's not going to be a basketball star. Everybody's not going to be football. Let's get on these books and educate people. That's where I think we need to start going and changing it. And I really like how Ian said, change the structure, because that's it. The structure, you get people who never been in the Black community, or people who never been around anybody with HIV that went into public health, or never worked in a clinical setting, trying to put in orders or say, this is how things need to be. But we work it every day. We know what it's like. I worked at the state and I only worked there 3 months. I promise you, 3 months, and I had to come back because I can't work like that. You have to get everything approved and go through this and go through that and go through here. And then if somebody doesn't like it, you have to start all over. But they want you to talk about how to educate people. But then when you're talking about saying having anal sex or talking about raw sex or this or that, you're not supposed to say that. You're supposed to say abstinent. Really? We want everybody to be abstinent. But honestly, if you look at the stats and you look at the numbers, it shows differently. So I'd rather teach you and educate you. I'd rather teach you and educate you on what needs to happen if you get in those situations and provide you with them. But like, we even go into the schools and we can't even say condoms. We have to say other things like safe sex precautions and things like that. We can't enunciate the word condom.
That's crazy.
And tell them, and we can't provide them with condoms. They have to see us outside to say, hey, let me get you some condoms. So it's the different factors in the breakdown that we have that we deal with, and that's the sad part. So we all in the same fight, and I think we fighting together. It's just if we can get other people on our same goal and our same vision, I think the world will become a better place. America will be greater than what it is.
Indeed.
I thoroughly enjoy both of you all's explanation and how you laying out and how you use cultural humility. And one of the main reasons is I'm the straight guy who got the job in public health and HIV/AIDS, who had no idea what I was getting myself into. All I know, it was better than throwing newspapers at 2 a.m. And so, and I can remember because when I got the job, it was at the health department. It was under the exact position at that time was sexual violence prevention program manager.
Wow.
But I had no idea that I would be 10 toes down in the HIV/AIDS prevention game.
Right.
So because that program was within the HIV/AIDS program. So I've started 1 week, I'm on sexual violence prevention. The next week, okay, now let's get you all this HIV information.
Right.
And these are the populations that we're working with.
Right.
And so one thing I did was shut my mouth. I like to talk, but I had to shut my mouth and I had to sit back and learn. Like Mathias is one of the people that I was able to learn from over the years as far as a straight black man, how can I be an asset? Not just somebody who I hear just a talking head, but how can I be an asset within communities that I know nothing about?
Right.
And the one thing was shut your mouth and go learn.
Right. You know what's funny, Joe, is that I tell people all the time that you have to sometimes just be a sponge,
Yes.
right? Like you have a lot of knowledge, you have a lot of this, but sometimes when you're going into arenas, and this is what I had to learn when Ian started taking me around places and getting me in the door, right? I was telling Ian, he was like, "What'd you think about this and that?" And I said, "I just literally was a sponge." Ian told me one time, he said, "You know what, brother? God forbid, but if something ever happens, I just want your tablets and your laptop because you take like nobody's business." And I appreciate you for doing that because I have a lot of family members that are I don't look at them as either straight or gay, right? They're just my family.
Right.
And that's I look at my friends, right? It only comes into play whenever we're talking about HIV and things like that. Oh, I'm straight. I wasn't asking about whether you're straight or not. I'm just want to know, do you understand what we're talking about? Like, do you get it? So I appreciate you for saying, hey, let me just shut up and let me see what's going on. Because I'm pretty sure you got a lot of flack in the beginning working with HIV, the LGBTQ community, things like that.
And me and Mathias had this conversation all the time. It upsets me, but I get what he's saying, but it upsets me.
Right.
Because it's like, for you to have to tell me, I have to be careful about being your friend.
Right.
Because of the way people act.
Right.
So for me, like, from my back, first thing, man, anybody got a problem, they can catch these hands. And you can think like that all you want, but then it's still at the end of the day, I'm not living Mathias's life. I'm not walking his shoes. So I got to shut up and listen to what he's saying and just see how I can be the best asset or best ally that I can be.
Right.
That comes from, y'all know, if you have a straight homeboy and you the gay person, and y'all hanging out, y'all close, everybody gonna start talking with all that talk and say, oh, well, you know, them two getting down, them two this. And instead of putting him through all the pain and all the aggravation, because it could become messy, especially if you have girlfriends and then they know his girlfriend and then they want to get with him, but they know this. So, oh, well, him and this is doing this. So just to keep all that out, I try not to hang around with a lot of straight men. And that's frustrating for me sometimes because some of my good friends are heterosexual. And so it frustrates me because I don't want you to get that backlash. Even though I know your wives or I know your girlfriends, or even if you don't, I still don't want you to have to go through that kind of stuff because you're just hanging out with me. And I feel like I'm bringing that burden. So that's why he be like, well, what you talking about? I was like, because you got to think of the mindset that people automatically see. Because when you see somebody out at the club or you see something, the first thing you say, girl, who is that?
Yeah.
Like, he get down. Like,
Right.
so, you know what I'm saying? So you try not to put them in there. Now, Joe and I go out to the club and we do education at the gay clubs and everything like that. And you just got to be like, I'm like, Joe, be prepared to get these questions because this is what's going
Right.
to happen. So, but, you know, people don't question or inform people who are heterosexual on the gay lifestyle. Like, you can't just go out in the gay lifestyle and sit there and look at people and be staring and then start laughing. You're going to get into a big fight.
Right.
So you just got to know how to approach things and how to acknowledge people and say things because you might think this is a woman, but it's not.
Right.
There's a lot of trends that pass for women, and right now the trans men are on the rise, and you can't tell the difference between a trans man and a real man.
Right.
Between the facial hair and the deep voices, and I'll be like, you sure? Like I saw an ad on one of the things, and it was like, we get periods too. And it just brought a light to my attention where it was all trans men and they had regular boxers on, like men underwear, but they had the period spots. So it was like when people was like, well, I don't understand, men don't get periods. Those aren't men. That's what we need to educate people on, how people are changing. It's not always everything that you look at isn't going to be the same thing that you think it is. And
Right.
so it's just teaching people about the difference. It's a lot of different slang. Like Joe had to learn. He was like, well, what's the top and the bottom? But he's scared to ask people. But you got to ask the right people.
Right.
Right.
Because the other people can kind of coerce and do whatever they want to do. And so that's where I try to teach Joe and other people that we get, like our interns. They really enjoy it because they get to learn and get educated on something that's not just a textbook, because the textbook version of LGBTQ is very small. And it's not really the realistic version. It's the back Paris is burning version.
Right.
And that's
Right.
not the same. And how people say, well, I never knew that you could be a professional black man and still be gay. I thought you had to be dressing in girl clothes and this. And so it's just trying to change that culture. And I think that's
Right.
what it helps when I have a straight person that's there and be like, you know what? And then here at work, my bosses buy into what we're doing and they support us. And that's
Gotcha.
the other part because they want to learn. They want to educate themselves. And I think now with 2021, I think people are more into that changing and saying, okay, it's time for me to stop being in this box. And like how Miss what's her name? Miss oh gosh, what's her name? Miss Jackie.
Jackie,
How
Yeah.
she
yeah.
told us, you know what I'm saying? We're not in the box. It's not the new norm. This is
Yeah.
our new normal. You know what I'm saying? It's the new now. So this is what people are ready to do and break out these boxes and stop putting people in about, oh, you're a gay man. This is it. This is all you can do. Or this is a straight person. This is all you can do. Or this is a white person, black person. So stop putting people in the box. And I think 2021 is going to be our year where we break out those boxes
Right.
and the
Right.
folds decides come down and we all open up to be who we want to be and start living in our truth, because more and more people are living in our truths. And it
Right.
takes people like myself and you and Ian and Joe to really live that truth and say, hey, I'm here and I'm not scared. I'm here in this fight. What are we going to do?
Right.
Where
And
do
I
we go
think-
from now?
And I think you just hit it on the head again. I think we have to change the landscape, as Ian said earlier, as Joe has said, as you've said. We got to change the landscape, and I think I want to say this before we get out of here, because I said this on my podcast the other day, and somebody challenged me that it wasn't Black history. And what I want to say is that that type of thinking, HIV/AIDS, LGBTQ, hetero, homo, all this stuff is part of our history. And if we don't acknowledge the fact that it is affecting us or effecting us in a way that is killing us, we talked about Black bodies being in the street. Like there has to be something wrong with that. And we got to get away from the fact that it's nothing wrong with it until something happens. And like you just said, educating and letting people know, because I'm constantly talking to, and I'm not even going to say my straight friends, right? I'm constantly talking to my people in the community of how we've bought into saying things. Like I had talked to a guy the other day, and he said, well, I went out with the guy and I really, really like him, but he felt me up in the parking lot. And then I said, well, what did you say or what did you do? And he was like, well, that's just normal. No, that's not normal. That's not, we have to get away from that. So just like the stigma, we got to stop HIV stigma. We got to stop all this stuff. So I just wanted to say to that that our history is now. We're making history right now, and it's specifically Black history. So I want to thank y'all for doing that. I know we got to get out of here, but I just wanted to say that before we do. Thank you all for changing the landscape. And even if it's just a notch, right? We push that needle. We push
Right.
that needle.
Exactly.
Yeah, and I just wanted to end talking about history and thinking about all the work that we're doing. I read a lot, but this scripture, I've been like looking at it a lot, and I had to just bring it up because I think it's a powerful way to end why we do the things that we do, no matter what our intersections are, or you know how we feel. Whoever is listening, I think this is powerful, and it's actually a Bible verse, surprisingly, from it's in 2 Kings 7, and this is actually verses 3 through 4. Now there were 4 men with leprosy at the entrance of the city gate. They said to each other, "Why stay here until we die? If we say we'll go into the city, the famine is there, and we will die. And if we stay here, we will die. So let's go over to the camp of the Arameans and surrender. If they spare us, we live. If they kill us, then we die." This particular story in the Bible is about the fact that lepers were not allowed into the city because of their disease. And so that conversation was them saying, hey, it's a famine in the city. So if we go into the city, not only will we die of starvation, we will die because they will kill us from coming in the city. If we stay here, for sure, we know we'll die.
Yeah.
But we got a little bit of a chance if we go into the other land and figure out if there is food and treasure over there. What was interesting about that story is the Arameans were ran out of their city and left all of the things that they had stole. And so all of the food, all of the treasure was in the city when the lepers got there. And the lepers then said, "This is wrong. We can't be celebrating this without telling our city that they don't have to die from famine." And they went back to their city that they couldn't get in to tell the good news. I think the great news about that narrative is that who is going to bring us out of famine will
Right.
look like the people that were ever let into the city. I am called to be
Oh, say that.
That's real.
that, though they have counted us out and not let us into the city, I am grateful that where we are right now, we have found treasure, and I'm telling everybody about it.
How about this?
That's real. That is real.
Yeah.
Exactly. Look, we told y'all this episode was gonna be powerful. So before we close this out, where can people find you? What's the website for the Normal Anomaly social media handles? How can more people contact you if they want to work with you or interview you?
Yeah, so the website is normalanomaly.org. And you can hit both me and Tighten Up. We love to talk at founder@normalanomaly.org. We both are connected. The news is, and I thought, Titan would tell it. It's bittersweet, but it don't mean Titan is gone. So Titan has been empowered to take a new position at a phenomenal organization. And we have 2 new staff persons. So Titan will always be a part of Normal Anomaly, and he is on as a consultant consistently. He always has a space at Normal Anomaly, such an integral part of it. But in that, we're always ready to talk. We're always ready to do active work. And I'm so grateful for Titan being a part of this and being a part of the Normal Anomaly. But all of our social media is the Normal Anomaly. Our website is thenormalanomaly.org, and you can contact us at founder@normalanomaly.org.
He's Ian L. Haddock. He's Titan Capri. And this is Mind Your Body and Soul, greatest health podcast out here. Remember, Mind Your Body and Soul is an educational podcast that focuses on all things health related to help our listeners learn more about the various health topics and information that they may or may not have access to. So we seek to inform, empower, uplift, and mobilize our listeners to become the healthiest versions of themselves Remember, www.nmcpodcast.com. Catch us on YouTube, Anchor, Breaker, Radio Public, Pocket Cast, Spotify, Google Podcasts, all those things. We'll catch y'all next season, man. This is how you close the season now. We catch y'all next season.
Yeah.